I understand that the following information will be gathered and utilized for educational purposes by an Indiana Wesleyan University student. I give my permission for this information gathering and physical assessment to be filmed and posted for access by faculty and students at Indiana Wesleyan University.
Hello, my name is Kaylee. I'm going to be your nurse today. Can you tell me your name and your birthday before we get started?
My name is Jennifer and my birthday is 4/2/62.
Okay, can you tell me what brings you into the ER today?
A couple of days ago, I got bit by a spider on my left lower leg here, and I started to notice redness, pain, tenderness, and swelling to that area this morning.
Okay. Have you developed any fever or chills that you know of?
No.
Okay. Are you short of breath?
No.
Okay. Is that area draining or warm to touch that you've noticed?
No.
Okay. Do you have any history of like diabetes?
Yes.
Yes. Okay. Do you have any cardiovascular or peripheral vascular health conditions?
No.
Okay. Do you have any immune deficiency disorders?
No.
Okay. Do you take any medicines that could possibly suppress your immune system?
No.
Okay. Are you a smoker?
No.
Okay. Do you drink any alcohol?
No.
Okay. Or do you do any recreational drugs?
No.
Okay. Do you have any allergies to any medications?
No.
Okay. Do you have any medical history that you?
Yeah, I've got diabetes, and I take glucophage for that, and I've got high blood pressure, and I'm on lisinopril for that, and I've got high cholesterol, and I'm on Lipitor for that.
Okay. Have you ever had any surgeries in the past?
Just my appendix and my gallbladder.
Okay. Was that recent or was that?
No, that's been a long time ago.
Okay. I noticed your vitals in triage you were afebrile, you had a 99.8 fever, pulse was 97, your blood pressure was good at 133/70, your respiration rate was 18 per minute, which is good, and then your oxygen level saturation was 100%. Do you have any other problem areas on your skin that you want to address today? No. Okay, and do you have any other health concerns that we need to talk about?
No.
Okay, before I get started, for my assessment, I want to ask if there's any cultural considerations I need to be aware of.
No.
Okay, all right. I'm going to shine this bright light in your eyes. Just look straight ahead.
Okay.
Okay, that's good. They're nice and reactive. I'm going to feel your glands in your neck and just tell me if they're tender to touch.
No.
Okay. I'm going to listen to your lungs on your back real quick. Just big, nice deep breaths for me. Okay. Now the front, big deep breaths again. I'm going to listen to the front side of your lungs. You can breathe normal now. Your lungs sound clear. I'm going to listen to your heart now. Okay, if you want to go ahead and lay down, I'm going to assess your belly. Have you noticed any tenderness to your belly? Any nausea, vomiting, anything like that? Okay. Can you lift this leg up for me? This is the affected area, correct? Okay. And then lift this leg up for me. Okay, good. I'm going to check your cap refill. It just shows if your tissues are being perfused correctly, and that's good. And I'm going to check your pulses, and they are equal and very strong, which is good. Okay. I'm going to feel your pulses down here to make sure that they are equal and strong. And they are. And I'm going to go ahead and take this sock off real quick just to check your cap refill since this is the affected leg. Okay, good. Okay. All right. I'm going to put some gloves on. I'm going to touch this area just to see if there's any drainage to it. It doesn't appear to be very warm and it's not draining anything. Okay, you can go ahead and have it. You can go ahead and sit up. So since you were bitten by a spider and that it's starting to be red and tender, I assume that this is probably a case of cellulitis. Obviously, the physician will have to make the medical diagnosis of that. Cellulitis is a bacterial infection of your skin and the surrounding tissues beneath the skin that is not contagious. Here in the ER, nurses can do blood work and other testing according to symptoms before the doctor even comes into the room. Typically, whenever somebody comes in with cellulitis, we like to get labs, typically a CBC and a CMP to check out your white blood cell count and your electrolytes, kidney function, liver function, just to make sure everything checks out okay. And that will also tell us your blood sugar on the comps to see if it's high. And we also, since you're starting to develop worsening symptoms, we'll probably get a lactic acid blood cultures just to make sure that bacteria is not spreading throughout your bloodstream and make sure you're not becoming septic. The key treatment for cellulitis, if this is the case, is antibiotic therapy. If this is the determined diagnosis from the physician, it is very important to start your antibiotic prescription as soon as possible and make sure you complete the full prescription so that way it's effective and that way it's throughout your, it's not spread elsewhere. If you do develop a low-grade fever throughout this course, try alternating with Tylenol and ibuprofen first. And if your fever does not become responsive to that, or if you start to develop increased drainage, warmth, or any other concerning changes of that area, of that sense, always come back in for reevaluation. Do you have any questions right now? Okay, I'm gonna go ahead and get started on the blood work and labs and get those processing before the physician comes in here to see you. He should be in here as soon as he can to evaluate you and see what the next step is.
Okay.
Okay.
Sounds good.
All
Thank
right.
you.
Thank you.